This weekend, the annual City to Gong bike ride marked its 30th year. 10,000 people made the 96-kilometre ride south to Wollongong from Sydney to raise money for multiple sclerosis in Australia. MS is an autoimmune disease that attacks the central nervous system, and this year, riders had some extra inspiration, spurred on by some breakthrough research linking MS and vitamin D. Prue Guillaume of MS Australia believes this study is a step in the right direction to finding the cause and cure of MS, but believes a lot of work still needs to be done.
There still needs to be a lot of clinical evidence to back that up before organisations like ours can go and tell people to definitely take vitamin D for MS, but that's happening at the moment, and we're advocating for those vitamin D trials.
This year, MS Australia is hoping to raise $4.5 million for support services for MS sufferers and advance the vitamin D research. Published in the Journal of Neurology, this breakthrough study released in Australia was conducted by Dr. Mark Stein of the Melbourne Hospital over the last 2 years. It tested a variety of vitamin D dosage levels on MS sufferers in a hope of discovering if this supplement had a positive effect on the treatment of this disease. Kerry Morris is one of the many people involved in the City to Gong bike ride and is excited by the overwhelming support they've received this year.
The event's been 30 years in the making and aiming to raise $4.5 million. So that money will go towards providing services for people with MS and probably also go towards research and finding the causes of MS and hopefully coming up with a cure.
To date, there has not been much hope for sufferers as the cause of the disease remains largely unknown. It is thought that the new theory, linking both genetic and environmental factors to the cause of MS, is possibly what has led scientists to finding this relationship between vitamin D and multiple sclerosis.
Interestingly, there's a lot of evidence that where you live in Australia makes a little bit of a difference. So more people in Tasmania per capita have MS than you would have in Queensland. So the closer that you get to the equator, the less chance you have of having multiple sclerosis, and that's led a lot of research into vitamin D and what impact that has on the disease.
While the study is the first of its kind in our country, Prue and MS Australia are hoping this has created the awareness needed to start further, larger-scale trials that will be able to conclusively determine this link.
And there will be future studies, we hope, in Australia, and we're advocating for that to happen. So we've gone to government with submissions to fund vitamin D prevention trials, and we'll be actively trying to get funders for that. Research is very expensive, but to do a proper study of whether vitamin D can make a difference, we need the dollars to be able to run a big clinical trial, and we're committed to making sure that happens.
Gail Carter and Kerry Gill are first-time riders in this event, both riding for people they know that have MS.
It's been great fun, hasn't it? It's been great fun leading up to it, being involved in fundraising, just getting excited and nervous and being
and we're able being bodies, and some people don't have that opportunity to get out and about, so it's great.
Absolutely. Live every moment while you can, and this is a great opportunity to do it.
As part of the fundraising for the City to Gong bike ride, Gail and Kerry have nearly raised $2,000 for MS Australia and believe it's great to know their money can be put to such beneficial research in the future.
Exciting, actually. People have been really, really generous and supportive. I think it's a great opportunity for raising money because people support not only MS Australia, but they're supporting us as mates and family members as well, and just encouraging us to do something really worthwhile. So that's good.
This is Caitlin Meredith for the Milk Moustache.